Welcome to today's edition of Mental Health Matters. Today, we're going to be talking about stigma. I have Richard Gallo on the show today, and this is part two of Richard and I sharing our personal experience about the word stigma. Get you something to drink, get you a snack, and come on back. All right, Richard, welcome back. How did you enjoy your little break there?
Refreshing. That's all I can think of. Refreshing.
I love it. So when we left off from part one, you was talking about this book you got. Let's dive a little bit deep into that book, and it sounds like it's very beneficial for folks who are living in recovery or who have lived experience.
It is. It is. I think it can be done um, by teachers, by adults like you and I.
Yeah,
Um, you know, sharing this book, utilizing what's in the book to help them to make it through the recovery. To make it through that stigma that they have to deal with
yeah,
every day that we face with, whether it's on TV, in the community,
yeah,
yourself, because
yeah,
you're getting that reaction.
yeah. What is the name of the book again?
Mental Health Survival Guide.
Mental health.
And and it's written by Mental Health America. You can
Okay,
order
nice.
it from their website.
Okay. Do the book offer like activities in there as well? Obviously, it's information, but
I believe so, if I remember correctly. I scanned through the book without actually reading it because I've just been busy. But
okay.
I will eventually sit down and then sit with the residents that I think would be helpful so
Okay.
that they can be better acceptance of themselves as an individual with mental health challenges.
Okay.
It's part of through that grieving process of the stigma of the denial, don't want to be associated as an individual with a disability.
Yeah. Okay. Okay. So Max texted me and let me know that the event or movement that I was talking about was Stop Stigma campaign. And that is so I looked on just on the website or whatever, and it says it would take the voice of many to stop stigma and discrimination in our community. Hear firsthand stories of hope and recovery as shared by community members. I'm
Yeah.
telling you, that is such a powerful way to stop the stigma and discrimination because you're hearing it from people firsthand.
Yes.
You know,
And,
I,
yes. And
yeah,
I believe your local NAMI chapter have a similar program like this, where
yeah,
they utilize person with lived experience to educate the community, to
yeah,
educate in the workplace about mental health and mental wellness as well.
yeah, yeah. And it's important for those folks' voices to be heard because it does offer hope. I mean, just because people are living with a mental health diagnosis, it doesn't mean they can't be productive. It doesn't mean
Right.
that they can't hold down a full-time job. It doesn't mean that
Right.
they can't live as a productive member of society. And I'm going to go back to my initial comment in the first segment of the show. We all will have days, whether you are diagnosed with a mental health diagnosis or not,
Or
we
not.
will have those, right. We are all going to have those days where we are experiencing something. I know folks who have communicated with me that before they go on a job interview or in a job interview, they experience a bad anxiety because they're nervous, they're scared, they're fearful. Well, you
It's
know,
a normal reaction to go through that, you
right,
know?
right, exactly. So I think what we have to do, continue to do, is normalize mental health diagnoses. You know,
Yes.
we have to educate the community and people. And one of the things I do love about the mental health movement is we are finding a lot of people who were not necessarily educated. We're finding a lot of them to a degree getting on board because a lot of their family members are now getting diagnosed.
Mhm.
Their money, their prestige, their race, their status, it can't take away what their loved one is going through. You have to eventually get these people support, and it's
Yes.
educating them by them going and talk to the doctor, psychiatrist, or getting a medication, whatever the case may be. It starts to
Right.
open their eyes. So I love that part,
Right.
that it's starting to be more normalized
Right.
than opposed to, yeah,
And NAMI offers programs for families so that
yeah,
they can understand and be educated about mental illness
yeah,
and its challenges. And for families, it's also good for them to take the mental health first aid too, so that they can have a good dialogue without having to struggle. Because
right.
that's one of the main issues families face is they struggle maintaining that relationship after the diagnosis.
Yes. All, and it brings me into my next um um topic, or I should say topic, but my next the next thing I want to talk about. And this is stigma by association. And what this means is friends and family members of those with mental health illnesses may experience the effects of the public because the stigma that's attached to their loved ones. This can have like a psychological effect similar to those experienced. Well, let me reread that. This could have a psychological effect similar to those who are have a mental diagnoses. So, in other words, stigma by association. This definition is saying that your family member pretty much may have some sort of um some sort of what word am I looking for? Your family member may be affected by you having a mental diagnosis and so many words. And we know this to be true because a lot of times when family members have, whether it's kids, grandkids, brother, sister, spouse, when they start to experience mental health conditions, then it makes them feel some type of way, and they want to go and get the help because they don't want people, in a church to find out, or at the job to find out, or whatever. They try to hide this because
Right.
they're worried about their image, and it in actuality it really does affect them. You know,
Right.
so
Right.
I was talking to somebody not too long ago, and they was telling me about when they grew up, they didn't realize that something was going on. And
Mhm.
so when they started to reach out for help, professional help, the family members was against that because they were saying, oh, nothing's wrong with you and blah blah blah. Well, this person was very diligent in getting help and support, and this individual did. And so when he was diagnosed with the mental condition, now the family, they didn't want to accept it. They was
Yeah.
embarrassed. They didn't really, he said he wasn't really invited to a lot of family functions and all of that because his mental health condition.
Embarrassment.
Yeah,
Yeah.
exactly.
This is
Exactly.
embarrassment to the family.
Yeah.
Yeah.
Richard, what would you say to a family member who is experiencing embarrassment because their loved one has a mental health diagnosis?
It's really important that the family seek professional help to understand his or her diagnosis. Um, because they don't know what it's like being in that individual's shoe of what
Yeah.
they're going through with that particular illness. Each illness has its own, you
Yeah.
know, highs and lows and barriers and um, so it just matters getting support. Joining NAMI support group. That is a great place for families to be educated so that they can understand their child, their niece,
Yeah.
their nephew, their
Yeah.
grandson,
Yeah.
you know, about the illness.
Yeah.
Because once you understand it, then you can take the appropriate steps and continue developing that relationship that you had and develop that rapport again with
Yeah.
that individual
Yeah.
without the embarrassment, without the stigma, without the shamefulness,
Yeah.
without the guilt.
Yeah. I love that you talked about support group because support groups are very, very valuable in the mental health space because you are around your peers. You are around people who have been through things, who have their own lived experience, who are living in recovery or are working towards recovery. And I
Right.
think that's extremely important. And people who watch this video, I hope they get out of too when you're dealing with or if you're seeking resources regarding support groups, there are different type of support groups. Do your
Correct.
research. You can get a
Correct.
support group strictly towards grief. You can get a support group strictly towards schizophrenia. You can get a
Mm-hmm.
support group strictly towards depression and anxiety. Like,
Right.
really do your research.
Anxiety and just goes on and on. It's
Yeah,
across the board. Yeah.
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 Find out what works best for you if you're truly seeking help to educate yourself and to be a support system to a loved one.
Right.
Um,
Because one of the problems that I face working with individuals when I did benefits counseling for individuals with a sudden diagnosis of mental health challenge is the unwillingness to go on disability benefits.
yes,
And this is where I have to educate them. You need income coming in to be able to live, to be able to support yourself.
yeah,
Without that income, you're going to be destitute. Without
yeah,
that income, you're going to be homeless.
yes,
Let me help you apply for disability benefit because that's my background. The
yeah,
second thing I let them know is just because you're applying for disability benefit does not mean you have to stay on it permanently.
hmm,
You can eventually go back to work full time or part time if you're not able to work full time because of your mental health challenge that you're
right,
dealing with.
exactly. That's exactly right. I so at one of the spaces I was in regarding work, part of my role was to interview individuals who were homeless that were looking for like transitional and permanent supported housing.
Mm-hmm.
And so I interviewed a while back. I interviewed this guy. He was like 21 years old, and that was one of the things that he said was he didn't want to go on. He didn't want to get SSI. He didn't want to get money from the government. He wanted to work because he didn't want it to stop him from making as much money as he was. And so he was there
That's
with it,
okay.
yeah, with a case
I
manager.
support that.
Yeah, yeah. But the problem was he had been well, let me say this. I think he had unrealistic expectations.
That could be it. Mm-hmm.
Yeah. And so when I got the referral and all that, and when I was talking to him, I had to make him see both sides, because I felt like yeah, it was great, but you've been at this for like a year and a half, 1 or 2 years, and you still there's not been any movement with your income. There's not been any movement with your goals. So use this as a stepping stone, like you said. You don't have to stay on
Mm-hmm.
there. Use it as a stepping stone, because you're gonna need income when you get housed. You're definitely gonna need to pay
Mm-hmm.
some sort of um rent or something. So when I got through talking to him, he understood. And that's one of the things I do. Like, even like outside of work, when I run across people and talk to people, I tell people this I work with, my work do not stop when I leave this building. I
Mm-hmm.
still like talk to the people in the grocery store I'm telling you about in the last segment. I still try to educate people and help people, provide resources to people so that people can know, because we got people in these programs like NAMI, Cal Voices, TLCS, and other places, but we also got a large group of people who are homeless that are not connected to resources.
Right.
And that's what people like you and I come in, that when we're off from our 9 to 5, we may be out going to get some gas or grocery shopping or whatever we're doing. We still have an opportunity to be advocates and share resources that could
Yeah.
potentially help somebody. So
Yeah.
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 Um, so what do you think the word stigma has on the mental health community? Do you think, or let's talk about the positive and negative effects. And I know we've kind of talked about it a little bit, but this is one of the questions I got.
Mm-hmm.
What are the positive and negative effects the word stigma have on the mental health community?
Since this morning, I've been up through the night. I'm having a hard time thinking about anything that's positive.
Okay.
So, excuse me for that, Jesse.
Okay.
The negatives is what we talked about in the segment. It really affects the individual with the mental health, having that mental health challenge
Yeah.
tremendously.
Yeah.
It's a pushback for them. It's a oppression.
Yeah.
It's just a negative black hole
Yeah.
that you're putting these individuals with your stigma
Yeah.
in regard to our population, to our community.
Yeah.
So it has a tremendous impact. That's why we all have to work through our self awareness, our
Yeah.
self identity, and the acceptance
Yes.
to be able to succeed, to be able to not take stigma personal.
Yes. That's
You walk
exactly right.
away from that.
Yes. That's
Don't engage, disengage.
mm-hmm.
Because sometimes those individuals that choose to be ignorant are going to be ignorant regardless.
Yeah.
You
Yeah.
say, just
Yeah.
like you with that lady in the store.
Yes.
Perfect example.
Yes. Exactly. Exactly. And I'll talk about the positive aspect of the word stigma. Um, it's exactly what you just said. When you see that people have negative um, mindset and producing negative results, whether it's through actions or whether it's
Mm-hmm.
through conversation with the word stigma, then you have an opportunity, like what I did, to educate them,
Right.
to
I
advocate.
mean, look at Lady Gaga.
Yeah.
She's famous. She's a
Mm-hmm.
person with a lived
Mm-hmm.
experience. She's
Yes.
gone through stigma, being
Yeah.
rejected, and
Yeah.
yet she managed to make herself successful in the
Mm-hmm.
entertainment business as a singer. I remember seeing her before she made it big in San Francisco when I volunteered for a deaf organization that serves the deaf community in the Bay Area. I
Yeah.
didn't know who she was. The
Yeah.
whole crowd knew who she was, but I didn't know who she was. She's talented as a musician. She's not my kind of music,
Yeah.
but she is talented in her own unique way. How
Yeah.
she did not let her illness affect her,
Right.
put a barrier on herself,
Yeah.
reduce her goals, reduce her expectation,
Yes.
reduce her desires, what she wanted to do. And
Yes.
look at she is. She's on top of the game.
Exactly. And it's so important to have that motivation to be able to break through those dark times, those moments when you want to give up, those moments when you want to isolate yourself, those moments when life is challenging you. And it's good to have that, whatever she did, that support,
Mm-hmm.
resources, whatever she did, she definitely she broke through. I know a while back I was reading something. It's funny you talk about her too. She had did a movie with it was a singer movie too with this
Yeah.
a while
I
back.
can't remember the name, but yeah, I know who you're talking about.
Yeah, and I was doing some research, and it was said that she had left Hollywood for a while because of what was going on. And I felt like during that time, she realized that she had to kind of drop off the scene to kind
Mhm.
of take care of herself. You
Right. And
know?
I think a lot of that has to do with her giving herself self care.
Yes,
She
exactly.
needed to be away because she didn't want to see herself drop bottom.
Exactly.
Self
Exactly.
care is important for all of us to
Yes.
maintain our recovery. And,
Yes.
as far as being celebrity, sometimes they do need to step away
Hmm. Yeah,
to
absolutely.
maintain themselves.
Yes, exactly. 'Cause they will fall under like the public stigma. You see,
Hmm.
Robin Williams, a very successful
Yes.
actor and comedian, he committed suicide.
Oh, yeah. I
You
know.
know,
How
unfortunately,
unfortunate.
yeah, yeah,
And yet he was an incredible actor. A
hmm,
lot of actors can't do the roles that he did,
right,
especially the different types of roles
yeah,
that
yeah,
he played. Mrs.
exactly.
Doubtfire,
Mhm.
Dead Poet Society.
Yes,
An incredible actor, and it was such a huge loss that we lost him to
yeah,
suicide.
yeah. But you got two different type of people in a entertainment business. One is a
Mhm.
singer, one is an actor. Both clearly was dealing with some type of mental health
Mhm.
concerns, issues, or conditions. One was able to step back, do self-care, jump back in her craft. The other one unfortunately took his life. You know,
Mhm.
once again, that, and to add on to what you're saying, it is super important to know the value of self-care. When you do self-care, that does not mean you are a failure. That does
Correct.
not mean you're giving up. That means that you realize that, okay, I'm not well, or I need to take some steps back and,
Mhm.
get myself together. And
Yes.
that's totally fine. Totally,
Because it
totally.
takes a toll on you if you do not do your self care.
Yeah, yeah, absolutely. I um I know an individual who was, how can I put this? I'm trying to think how I could relate it. This individual was let go from a job a while back. And it was totally discrimination, 100%, because I just knew I was coaching this person through. And I realized when the person was at that job, Richard, this individual was under so much, when I say stress, anxiety, violent depression, like it was like no other. And this was like, this person was going through this for like 8 or 9 months. The moment that this individual got terminated from the job, and it was totally through discrimination, it was not that this individual did wrong. I immediately, because I got a text message and they called me, and I'm just like, oh my God, I'm like, okay, on my lunch, I'll call you. And so I ended up calling them but before I ended up calling them during that process, I felt bad. I'm like, oh man, I went in there, prepare myself to, be very sympathetic, just want to be there, console the individual. And this individual said to me, they said, when they called me in the office and told me that my position is no longer needed, this person said that it was like a weight lifted off my shoulders. I mean, their reaction was totally different than what I expected to be. Totally different. And so what the individual started telling me, they was like, now I can start taking care of myself. Now I don't have to be fearful when I go into work. I don't have to be, discriminated against with some of these words. And now they are doing extremely well. Matter of fact, from to start their own business. But it took from them to get terminated for them to do some self-care, for their mindset to be
Yes.
set back in a positive place. And so, the purpose of me saying that is sometimes the things that may look negative can actually have a positive outcome. In
Mm-hmm. Yeah.
Yeah. Rich, I want to ask you a question. Why did you dedicate your life to helping people with mental health conditions?
My first job that I got in high school with the Job Training Partnership Act program at the time, known as JPTA, um, was funded to help at-risk population. So the gangs, the individuals in low income, special education students, mental health students. Um, Even though I was in special ed myself throughout my whole school, it's just part of being around them, with them. As a student with a disability, as a special education student. So, that kept me going. I stayed with the job training program. They offered me full-time peer group counselor. I took it with not knowing that I was going to teach interpersonal skills, on-site job observation, job placement. It was a lot more entailed, but I loved the job. It was a new challenge for me. It was an incredible moment that taught me that I don't have any barriers as a person with disability, as a special education student that's about to graduate from high school, um, and having that connection with those individuals in the job training program and referring them to where they need to go to get help,
Yeah.
um, and encouraging them completing high school, because that was part of the job training program to get these students to graduate from high school instead of being a dropouts.
Yeah.
The other part of it is to encourage them to go further your education,
Yeah.
go to community college, go to university. And if that's not your area, go to a job training program, go to a vocational training program.
Yeah.
You know, college is not for everybody.
That's right.
So, and it's okay to go to a vocational school, or a job training school.
Yeah.
Um, so, and I've always stayed with the mental health field. I've worked with families with children with behavioral disorder problems in a short-term crisis residential program with the goal of the children returning home. So they're both intellectual disability and psychiatric disabilities. So this is the populations that we work with. So I not only taught parenting education classes with the parents, how to work with their children, how to work with their behaviors, but also to show the parents that they need to discipline their disabled child. Just because a child has a disability does not mean you do not discipline their child. Because the questions
Mm.
I always ask, who's in control of the household?
Wow.
The kid is,
Yeah.
not the parent.
Yeah.
So as they complete their residential program, 6, 7, 8, 9 months down the road, the family unit is a healthy family unit. They're
Yeah.
no longer struggling. They're no longer dealing with that negative behavior. They're no longer dealing with that aggressive behaviors.
Yeah.
The parents in control of that child.
Yes. Yeah.
So parents have to learn to be a better parent and utilize the tools and skills. Back then it's called behavior modification. Now it's called applied behavioral analysis,
Yes.
ABA.
Yeah.
So if I was stick in the field with me, I did one-on-one aids in the schools, helping
Yeah.
the child maintain the school setting.
Yeah.
I work with the County of Monterey Children Mental Health Services, giving the parents a respite, taking their child out in the community
Yeah.
so that they can have a break.
Yeah.
Because it's not always easy raising a child, especially a child that's behavioral challenged.
Yes. Yeah. You just said something real powerful there. And honestly, I didn't even think about that. And maybe that's going to be a topic on one of my next shows, actually, about raising and disciplining a child with a mental health diagnoses.
Mhm.
Because you're absolutely right. I've seen time and time again, people, and I could say it's within my own family too. people not really disciplining their child with the mental health condition. And maybe that's guilt, maybe they feel like,
Yeah.
oh, well, but we want to treat them normal and modify the situation as much as we can.
Mm-hmm. Mm-hmm. Because
But
one of the problems parents have is not wanting to use the ignore
yeah,
technique.
yeah,
Of course, the child is going to throw a tantrum and
yeah,
increase the tantrum, the yelling, the screaming. But
yeah,
if you stick with it over time, it's going to gradually drop the
yes,
tantrums until
yes,
it stops.
exactly.
Because the
Yeah,
child knows he or she can no longer push your buttons.
right. And
Kids know,
Mhm.
they pick up what they can do to
Exactly,
their parent, to their father, to their mother, and they're
exactly,
gonna do it. If they can get
exactly.
away with it, hell, I'll
Yes,
do it with you, Jesse. I want my
yes,
Starbucks coffee, man. I'm gonna throw a
exactly.
tantrum, man.
Exactly. Exactly. 100% facts. And that's what children's without a mental diagnosis, it's the same thing. They do the
Mhm.
exact same thing.
Totally,
Oh,
yeah.
that's powerful.
And the younger, the better outcome it'll be. It's just like catching your child with psychosis.
Yeah.
Earlier that they catch on, the better off they will be as an adult.
Yes, I
And
agree with
that
you.
treatment, that help is delayed. The damage it'll be long term.
Yeah.
No fault of their own
Yeah.
because it wasn't catch on time.
Yeah. Yeah. And I'm glad you said that because I do know one couple that who has a baby who is autistic, but they refuse to
Mm-hmm.
get help. They refuse to get help. So
Mm-hmm.
the family is working on them with that because the only reason why they're not getting help is because of stigma. That's the only reason
Yeah.
why. So the family is working on them about that. And I've talked to some of the family members about,
Mm-hmm.
resources when they're ready, to
Mm-hmm.
kind of let me know and I can guide them and direct them and stuff. But it's clearly,
Yeah.
something is they need to get help.
Yeah.
But Richard, thank you, thank you, thank you, thank you, thank you so much for taking the time out to come on the show today. This is by far, in my opinion, one of the better shows. You see,
Good.
people gave us some thank you in the chat. This was an excellent discussion around stigma, and I'm sure we're gonna do more shows together because you are a wealth of knowledge when it comes to mental health and advocacy. You can hear and sense your and feel your passion for
Mm-hmm.
the mental health community. So once again, thank you so much for taking the time out and to interview with me and just being able to willing to be there when I need you in this space. So
You're more than welcome, Jesse. Thank you. And remember, as I always say in my email, mental wellness is possible.
yes, absolutely, absolutely. And that's it for part 2 of this edition of Mental Health Matters, talking about stigma. If you like this particular show, if you like a DVD copy of the show, or if you would like to be a guest on our show, please dial 916 366 4600. Thank you.